So, hello everyone. Today we'll be talking about the specialty which is ENT. We had Dr. Amrita GM who will be guiding you about what is ENT specialty all about, and if you take ENT specialty, what will be the benefits and what will be your drawbacks for the same. So, Doctor, could you please introduce yourself to the audience?
Good afternoon, everyone. I'm Dr. Amrita. I did my MBBS from SS Institute of Medical College, Davangere, and post-graduation in ENT from Navodaya Medical College, Raichur. So I did my MS ENT surgical field. So okay, we'll start.
Okay, so doctor, could you please give an insight about what is ENT specialty all about?
ENT is a mixture of both medical and surgical fields. It is a very important branch, one of the important branches. So in ENT, we have two setups. One is medical, that is OPD setup, and another is surgical field. So post NEET exams, so those who are interested to do both sides, either you can choose you want to go for surgical field like that, or you want to do a clinical practice just with OPD. So both options are there in ENT. So basically we are dealing with the ear, nose and throat. So it is a very interesting subject, and it's a variety of cases you'll be getting in ENT. So it is different from other surgical fields. It's not open surgeries are very less in ENT, and you need lot of skills, and basically it is like a artistic surgery. You need lot of skills, and if you are interested in it, so definitely it is a very good subject to live with. Okay.
So, doctor, like other specialties will be divided into different branches. Is ENT also divided in any sub branches?
No, ENT is a end branch. So a decade back, it was considered as an end branch. So MS ENT was sufficient for you. But now there are so many fellowships. So there are so much MCH has come now. So yeah, there are so many options are there. In future, so many fellowships are upcoming, and among fellowships you have head and neck oncology, separate parts you'll be dealing with, like rhinology, otology, laryngology. So there are so many options in future after MS you want to deal with. But as a MS ENT, I feel this is enough for you to lead your whole career life. So if you are interested, if you're interested towards thyroid, open surgeries, carotid, you can go for head and neck surgeries also. Okay.
Okay. So, doctor, would you give an insight about how is the career opportunity in the specialty? If any doctor chooses a government hospital or a private hospital or opens his personal clinic, so what will be the benefits and what will be the drawbacks of that?
Okay. So basically, there are in everything you will have a pros and cons. So basically, what I want to tell to all NEET PG aspirants is you should know what you want, like what your heart speaks. Surgical field, there are two types of people, like who like surgical and non-surgical. So if you like surgical, so during internship only you would have decided. But in ENT, you will have a very less duration of postings, like 15 days for postings. In that, it is very difficult to decide. But during my internship only, I used to see some ear surgeries. It used to be like micro art surgeries. I used to like it so much, and removing wax and all that, I used to get very fascinated seeing all that. So I had kept this as an option. My first option was general surgery. I liked surgeries. So second was ENT, because you will have a both personal and professional life in ENT. So that's why I chose, and ophthalmology and other things also there. but you can choose whichever you are interested in. You can go with that, because don't go with others' opinion. Okay, what your mind speaks, you should go with. And later, every branch will have pros and cons, but after practicing, after post graduation, even during post graduation, I used to think, okay, there are not much options for ENT. Why did I choose? But after finishing, I'm realizing now there is so much demand everywhere. It depends on where you stay and how you go with options. So either you can go with further studies, or you can run your basic semi-luxury life, definitely with as a ENT surgeon. So there is no much emergencies in ENT. So to go with good things, like you have a lot of patients in ENT. Definitely in your families only, you will have so many patients like pharyngitis, nose problem, laryngitis. Definitely there are so many patients coming every day in ENT. Those are the good things, and so many are very common problems. Definitely once they have not taken proper treatment, definitely they'll come to you. All the time there is patients for you. Especially in OPDs, definitely there are much of patients. And you won't get bored in OPD, because we deal with ear, nose, and throat, and there are a lot of procedures going on. If you want to check into your throat, we'll be doing some endoscope procedure, we will be doing some syringing, we will be doing other maneuvers, and so many things. Definitely you won't get bored, even if you are going with a medical ENT. And there are variety of patients. Definitely there is lot to learn every day. There is lot to learn, and each day I learn something. And seeing some signs in patients, and that satisfaction is definitely there as a ENT surgeon. So both OPD and surgeries, so it's a combination of both. So it's definitely not boring for you. And drawbacks, if I want to say, so like there is no much satisfaction post surgery for the patients immediately only, I'm saying, because in cataract and all, you will see once the surgery is done, patients will say, oh, I can see properly now and all. But in ENT post surgery, if they come with sinusitis, we'll be doing septoplasty. Post op, there are some problems will be there, complications will be there. So later, with time, they will get to know the effect. So immediate satisfaction patients won't show. And there is definitely postponing among all the ENT patients, like just sardi hai, cold hai, we will do the surgery later. They won't decide immediately. They just want to watch and wait. Unlike like other surgical field like gallbladder stone or anything, immediately they'll feel, yeah, I'll get it removed, I'll do it. But in ENT, surgeries keep postponing, and definitely it is all about how you deal with the patients, and definitely how you counsel the patients. Only when surgery is needed, once the medical line of management fails, then only if you are going for surgery, then only patients also will follow. Immediately patient is coming, and if you are telling surgery and all, definitely they won't agree. It's all about how you counsel, how you speak to the patient. Most of the time it's about speaking with the patients and ruling out other options and going for diagnosis. So definitely you'll become more social. So if you're an introvert, definitely you'll become more social person. So, and drawbacks, another drawback is you need lot of skills. So there are advanced instruments have come now, like microdebrider and all that. So you need that practice. So actually in post-graduation, you are supposed to learn all the microdebrider things, and all advanced techniques also you should learn. But these are the things which are coming in ENT. You're supposed to learn. It's a never-ending story. You need to practice, you need to attend workshops, you need to improve yourselves. So definitely this is there, lifelong learning is there in ENT.
Okay. Doctor, could you give an insight about what is the salary, like how much income they can be earn if they take ENT as their specialty in all the aspects, like in the if they work in a hospital or if they do their personal private practice? So how much they can expect?
So it depends on your interest again. So if you want to go for the medical college, so it is like you will be doing SRship first, and assistant professor you'll become, then associate. So it's all about which position you hold. So either you choose a medical college field, or you go for a corporate setup. Okay, where you will run your own, you will take your own decisions, and in medical colleges as SRs, you'll be getting minimum 70. As AP, you'll be getting 1.2, 1.5. So it takes time for you for the promotions. In corporate setup, it basic some salary will be there, but it's totally depending on how many surgeries you do per month. It is like that. So minimum 1.2 definitely you can expect, and definitely you can have that semi-luxury life as a ENT surgeon, and it is not that hectic. So if you want to take a call, you can take. If not, you can leave. So you can decide for your own self. And there are no much emergencies, and you will have definitely have that personal and professional life in ENT.
So, doctor, last question: how difficult it is to diagnose the patient? Like, diagnose the patient also, and to like handle the patient. It's like, do the doctors need to be very patient for the specialty?
Definitely you need to be very patient, because in ENT, since it is everything is related to each other, ear, nose and throat, you need to rule out things. So you need to ask other things. If patient is coming with nose problems, and you will be asking ear problems, and vice versa, they'll get irritated. I came with ear problem, and why you are checking my nose, throat and all that? So definitely you need to have that patience and show them pictures, have some videos, explain them how it is connected. Definitely they won't know the anatomy, right? If you definitely have patience and explain them with some pictures and posters, definitely if they know the anatomy, definitely they will trust you, and they will obey whatever you say. It is all about how you counsel the patients, and definitely patience is needed, because immediate relief won't be there. Sometimes you admit the patient, pain is not reducing, all that will be there. So some diagnostics test will be there, like endoscopes we have to do. Sometimes we have to go for CT scans and all that, FNAs, USGs you have to do. But sometimes patients won't be willing for all those things. You have to explain them what are the complications if they avoid those things. Okay. So once you counsel them properly, definitely they will obey you. It's all about how much patience you have, and how much you like the subject and you like your work. So minimum 15 minutes, 20 minutes to spend with the patient, explain them what is happening, tell them how to come back, like come for the follow-ups. So what are the complications of drugs? What may happen if they take this sprays and all those things, and how to avoid all those things? Like definitely some remedies you have to explain, like you have to keep your ears dry. Simply they can't keep their ears dry. So explain them how to do it, and do garglings, do take steams and all those things. So there are so many remedies, maneuvers. These days, patients are coming with so many vertigo problems these days. So definitely, they will be definitely very anxious. You have to tell them what is the cause for the vertigo, and tell them, reassure them. So there are some exercises for such things. So you have to go in other ways also, like for allergies also, how to avoid allergens and all those things. And migraine cases also are very common. You have to explain them why it is so much, and how you rule out and how to avoid such things. So it's mainly about speaking to your patients, as far as my experience.
Okay, doctor. Doctor, there is one more question. Like during our Instagram survey, now there was one question which was asked, like in ENT, is there is like an MD in ENT and DNB in ENT also? So
Yeah,
what
it
is
is
the difference in that?
MS in ENT and DNB. So earlier DNB was not considered as equal to MS, but definitely now DNB is as equal to MSENT. Your DNB will be definitely from your some corporate hospital, not from a medical college. But if the patient load is good, if you have a good instruments, and if the academics are good in such colleges, DNB colleges, you can definitely go with that. But drawbacks are you can't join any medical colleges. If you have taken DNB, you have to go for your corporate setup only. But you have taken MSCNT, either you can go for corporate or medical setup. That is the only difference I can say. But DNB practitioners are as good as MSCNT practitioners. But I won't advise you to go for diploma, DLO. So definitely once you are studying and choosing a career, it should have a long life. So definitely DLO, you will have a less options. If you're going for interview, definitely they will choose MS and DNB people first, and later they'll think about DLO. So DLO is not a good option, but DNB from a very good hospital is a good option.
Okay, thank you so much, doctor, for answering all the questions. Would you like to give any last message to the doctors when they see this video?
Yeah, I want to tell, not as a ENT practitioner, definitely as a doctor, you listen to your heart, what your heart speaks. You have to choose that. You might have already gone through all the postings, so you definitely have made a short list of it. Don't think my rank is this, I'll go for this. So even as a pathologist, if you have done a pathology from a good college, you can lead a very good successful life. So don't think clinical, non-clinical, among clinical, this subject, that and all. So all subjects are very interesting, very good to have, but it depends on which suits you. That only you know it. So you only choose it what you know. But ENT, definitely you can have both personal and professional lives. And definitely about luxury, you have the good luxury in ENT also. And it's very interesting, skillful subject. So there are so many opportunities. I mainly wanted to emphasize that, as I have realized now in recent times, there is so much demand and opportunities. Just with MSENT also, if you have not gone for fellowship and MCH, just with MSENT, you do have a very good opportunities worldwide. So definitely you can go for ENT. It's a very good subject to deal with.
Okay, thank you so much, doctor, for your time, and thank you so much once again for giving all the answers. So we'll end the session here, doctor. Thank you so much, doctor, for your time.
Thank you so much for the opportunity. Thank you.